The COVID-19 vaccine is extremely safe for our children. We have a number of studies that represent that. We've had a number of children already receive the vaccines and have been able to monitor those children closely, and we feel very confident this is a safe and effective vaccine. It is certainly true that children are not as often affected by COVID-19 or as severely affected. That doesn't mean they are never affected. Especially with our last surge, we saw children were one of our highest populations of patients affected by COVID-19. So we still feel that the vaccine is extremely beneficial to protect our children. There are many benefits to receiving a vaccine for our kids. Preventing the infection is one. Preventing transmitting that infection within a household, a school, community is another. We also know there are potentially long-term effects from getting the infection itself. Some patients and children have symptoms such as shortness of breath, headache, fatigue, cognitive changes for months after an infection. And of course, we know there are some children who get severely ill, are hospitalized, and can die from COVID as well. The most common side effects of the COVID-19 vaccine are very similar to our other vaccines. Pain at the injection site, redness, swelling. Some children may develop some other what we call systemic side effects such as fever, muscle aches. They tend to be quite mild, and most children have done really fine with their vaccines with no side effects at all. Parents are worried about side effects interfering with school or activities. One way that you could think about that is maybe scheduling it on an afternoon or a weekend so that you can monitor the child. But most children will be able to do just fine and be able to go back to school and their school activities.